Okay, you're good to go.
Good evening, everyone. I'm Amy Hendricks, Deputy County Administrator here at Tompkins County, and I'm joined tonight by Jason Molino, our County Administrator, Frank Krupa, our Public Health Director, and Jay Franklin, our Planning Chief, as well as Assessment Director, as we talk about what's happening with our emergency operations and moving forward in response to COVID-19. We're going to be going through a bunch of questions that were submitted today and throughout the weekend and answering as we are able. I will give the disclaimer that this is what we know at this point in time, and we'll continue to move forward throughout this. So with that, I'm going to kick off with the first question going to our County Administrator, Jason. And the question is, what does it mean that the Southern Tier is now able to reopen?
Good question, Amy. Good evening, everyone. So what it means that the Southern Tier is able to reopen is that the governor and the state put out 7 metrics for regions to achieve in order to become eligible to reopen. Our region is the Southern Tier region, and today we were identified as one of the 3 regions that should be able to open on Friday. Opening by meaning that phase 1 of the reopening, which would allow for construction, manufacturing, and some retail with curbside pickup to be able to reopen. There has been a regional control board or regional group that's been put in place. I, along with several other county administrators and county executives, have been selected to sit on that regional control room board or group to monitor or observe the metrics on a daily basis to ensure that we maintain our numbers within those ranges and the set criteria. We're also there to take information in from the state and be able to relay it to our communities, as well as take information in from our communities and relay it to the state. Much as you mentioned earlier about what businesses and what industries and more specificity fall within these phases is yet to be determined, and the state acknowledged today that they are going to have probably every day moving forward new guidance for those businesses to follow and what businesses fall within each phase. We had some information today that talked about businesses, are businesses going to be required to create reopening plans, and they are. They're going to be required to create reopening plans based on the criteria that the state is going to set for those industries. And then they're going to have to create those plans and implement those plans when they go to reopen. This is not going to be monitored or per se assigned or approved by the county or the state, but instead businesses are going to be required to go online to a state portal or a state online website and attest or certify that they have developed a plan for reopening consistent with the state's guidance. Now, all of this, as we said earlier, is still to come. The state is developing this material and hopes to have it out in the next few days. Then what will come after that is us monitoring our metrics, our healthcare metrics on a daily basis. Assuming we can continue to maintain those metrics as the opening of phase 1 continues in a short period of time, possibly 14 days after phase 1 opens. If the metrics continue to be maintained, we could then move into phase 2 and so into phase 3 and phase 4. Again, those businesses that are to be identified under what phases is still yet to be clarified and determined. I know there's a lot of questions around that, and we don't know that answer yet, but that will hopefully be coming in the upcoming days and weeks. And that's how individual businesses and industries will be identified within each phase and how they're set or expected to be open with respect to developing their own reopening plans. And that right now is what we know. Like I said, we hope to know more every day as we have these regional meetings. And as we know more information, we'll relay more onto the website as well as through public releases.
All right, thank you, Jason. The next question is for Frank. As far as reopening and getting people back together, what does that mean for gatherings?
Sure, well, it really hasn't changed the position on gatherings. It's still, we want to remain less than 10 people. But really what's important is focusing on face coverings and social distancing, right? Wearing cloth masks when you're not able to maintain that 6-foot separation. But ultimately we're still asking to keep gatherings very small and only when absolutely necessary.
All right, thank you, Frank. Another piece on that is, a lot of people are using masks. What are the rules around mask wearing and social distancing?
Sure. So essentially, anytime that you can't maintain the 6-foot separation, that you want to be wearing a cloth mask. And I know we've talked about this from an operations perspective for the county, as well as all the way to folks walking and running in the community. You can think, I'm going to sit in my office, or I'm going to go for a run, and I'm going to be able to stay 6 feet away from people at all times. But you don't really know that, right? You don't know how other people are going to act. You don't know what situation might present itself. So it's really important to just have that cloth face covering with you. And when you're out moving about and you can't be certain that you're not going to meet that 6-foot separation, you want to have your face cloth face covering. There you go. Sorry. Your cloth face covering with you and wearing it in those situations.
All right. Thank you, Frank. I'm going to move over to Jay to talk about the ROOP plan, which we've shared our framework, and I'll let Jay explain a little bit more about what a ROOP is.
We developed this framework for our county departments to look at in order to ensure that when we are going to open again to the public, that we do it in a safe and thoughtful manner. We wanted to give departments some guidance on mandatory things that we are going to require when we do reopen, such as wearing face masks while you are in the office and you can't ensure that 6-foot social distance, and all the way down to cleaning surfaces in between uses and making sure that we're going to do it in a safe manner. We also wanted it not to be just going back to the status quo as it was back on March 16th. We wanted to look at ways that we could reduce the density in the office by continuing the work from home or work remotely work that we were doing, but just as a way to make sure that when we do open to the public, that we're ready to do it in a safe and thoughtful manner.
Thanks, Jay. On the ROOP, Frank, where can businesses go to get additional information about how to move forward or create their own ROOPs or other documents?
Great question. The county is going to be launching this evening a reopening webpage, which will have links to the governor's web pages around New York moving forward, as well as have our ROOP framework that community partners, businesses, nonprofit organizations, and the general public can see the framework that we as a county government have tried to use in order to develop those plans that Jay was just talking about. So head over to that new website once we get it launched.
All right, thank you. So another question that came in is, how do we move from one phase to the next? Jason?
So moving from one phase to the next has not been clearly defined by the state, but what was alluded to is that if a region maintains the healthcare metrics that have been identified, the 7 metrics have identified through a 2-week period of say phase 1, and there is no increasing or significant increasing in positive cases, hospitalizations, ICU admissions, deaths, types of things, then you would be slotted or able to move to a phase 2. And I would imagine that would also require state approval to move forward. But the whole point of monitoring those metrics is to ensure that by going into one phase, we aren't triggering a negative impact from a public health perspective. So while there isn't a set time frame on it, one would suggest that a 2-week measurement period would be fairly reasonable to moving on to the next phase and then to the next phase and to the next phase. So that's yet to be determined. And, I guess the best thing we can do for now is continue to monitor those metrics, continue to take proactive measures like we have, both as a county in Tompkins County and a region. We've definitely contributed to the region's success with our mobile testing facility that Q Health Systems has put up. And we'll continue to do that. But that's pretty much, I think, where this is going to end up with respect to moving from one phase to the next.
All right, thank you. Another piece on the reopening, are there additional resources that people could use or people to look to that they can reach out to as far as reopening conversations?
Sure. So the state on our call today with our state representatives, they identified that they were going to be putting out some industry specific guidelines and parameters for businesses to follow as they develop their own reopening plans. And right now, I think that's where we're going to start to direct folks when that information comes out. We'll make sure it's accessible on our website. We'll make sure people are aware of it. We'll get partners to push that information out. And I think that's the best place that we can go to. sharing our route plans was really about sharing some of our process that I think people can start to build off of to begin with.
So another question about best practices as we bring people back. Frank, as far as thermometers and using the thermometers on employees as they all enter the buildings, what is the best practice for taking temperatures and how do we do that?
Sure. If you're going to take temperatures, a no-touch thermometer is the best way to go. They are somewhat hard to find, but they're becoming more available. If you're unable to do that, you can use screening questions to accomplish the same thing. Simply asking, have you had the onset of fever in the last 24 hours? Have you come in contact with a known case? Have you tested positive for COVID-19? Those some simple questions that you can use for screening can serve the purpose if you're unable. You just want to make sure if you're using a no-touch thermometer that you're doing it while wearing a cloth face covering to protect yourself, and really just making sure you're keeping as far away as you can during that process.
So one of the questions about that, if a business needs to get supplies when they reopen, where should they be looking for those supplies? Things like masks, gloves, thermometers, etc.
So we have some resources like hand sanitizers and cloth masks available, and those can be requested using the form that's on the County Health Department website. Many of the supplies that are not PPE related for healthcare are becoming more available. So I would encourage folks to shop around and try to locate those on their own. But if they have a need for cloth face coverings and or hand sanitizer, we might be able to fill those as long as our supplies last.
Okay. It's industry specific, and I think maybe the answer is, looking to the state for guidance, but just in case, what PPE should construction workers be wearing? How should they be doing that?
So I think we are going to get some guidance, that industry specific guidance. Cloth face coverings really are the main protection that we would want to see folks wearing when they can't maintain that 6-foot separation. We want to make sure we maintain the N95s and other PPE that are specific for healthcare workers, because there is still a shortage of those, and we need to make sure they're available in the event that individuals or healthcare workers have to care for a known or suspected case. So cloth face coverings should be sufficient, but again, the best case is to maintain that social distance of 6 feet or more whenever possible.
And so I think that feeds into the next question about social distancing and how it will change or not change when reopening begins. Any thoughts on that and how to prepare for that?
Yeah, it definitely will not be changing. Social distancing is with us for a while, as long as we're still waiting for vaccines and treatments. So while we're entering this first phase and future phases, that social distancing is going to be core to every step that we take. As much as we can keep 6 feet between us, and when not able to, wearing a cloth face mask, it'll allow us to continue to move through the phases and hopefully hold COVID-19 at bay.
All right. Jason, will the county be issuing reopening certificates or certifying businesses to start opening?
No, the county will not. What has been explained to us is that the state is going to create a online process of which businesses can attest that they have created a reopening plan. That reopening plan has the specific guidance and elements that they are requiring for businesses to reopen, and that plan readily accessible, and they're implementing it. And once they have that certification that they've submitted and attested to that, that is, from our understanding at this point in time, how businesses would reopen and how they would be allowed to reopen. Again, that process has not been set up yet by the state and should be forthcoming in the next day or two. But there would be no local, in terms of county discretion or authority in the approval of specific businesses.
All right. Following up with that, what happens, we're in this regional conglomerate, what happens if one county in our region starts to fall behind in the metrics? Can our businesses stay open?
So that's a good question. And I think it speaks to the value of a regional approach. If one county were to have an incident that took place and But yet the whole region is collectively working towards trying to maintain those metrics. It wouldn't penalize that one county, so to speak. I think the purpose here of this approach is to understanding that we don't stay within our counties. We are, we're a transit, community in terms of it's very easy to go across county lines, which is why they're doing this from a regional perspective. We share common resources with each other. Just again, the testing location and sampling location in Lansing, I think, has sampled residents from over 30 different counties in the state of New York, just to show you how much people travel and how we depend on each other. So to say that one county would be penalized due to any changes in that immediate moment, I don't think is accurate. I think what is accurate, though, is that if the region continues to decline or it does not improve or gets worse in terms of its metrics, then that may prolong or prevent the region from moving forward into the next phase. Again, we're going to take a collective approach here in Tompkins County. We're going to work with our partner counties in this region to ensure that if anybody does come up short, we're going to help them in any way we can, just as we have in the past. There's been 2 or 3 counties over the past several weeks that we've provided additional sampling kits to because they didn't have it and they were in need. So we'll continue to support them, as I would expect they'll support us, so that we can collectively as a region continue to move forward.
All right. Who determines which business is in which phase?
Yeah, good question again, and the state will determine that. The state has given 4 phases with 2 or 3 very broad sectors in those phases. Admittedly, that today they said we need to define that a lot more. And they will be defining it a lot more with respect to specific industries in those different phases. And I think once we have that information, we'll be able to distribute that and share that. But I would expect this week you're going to see some more definitive answers come down, at least for phase 1 and hopefully phase 2 in the upcoming weeks.
So I'm going to shift over to Jay for a moment. I think this involves some of the ROOP conversation. What did the governor mean by continuous health screening for employees to enter the workspaces?
Well, we're not exactly sure what he means by that. So we'll be checking frequently back to his website for more explanation as they fine tune their explanations. But as Frank said before, what we're doing as part of our ROOP is simply asking our employees to attest or certify when they come in, have they had that recent onset of fever? Have they been in contact with someone who's been positively tested for COVID? Just as that first initial screening, and we're hoping that they will take some self-responsibility to report correctly. And if someone does report, then they will be sent home and hopefully go get tested on their own accord for that.
All right, thank you, Jay. Finance and insurance is listed in phase 2, but financial institutions have already been essential. What does finance include?
Again, good question. And I think these are the types of questions we want to take back and pass up to the state so that we can get some answers as soon as we can to pass on to our community members. So I think this is a question for the state as to what they're defining. Is it a banking institution? Is it another institution? What are they defining as a financial institution? And like I said, hopefully in the next few days or few weeks, we'll have some more clarity on it.
So another question kind of in the same stream, many of the business account holders are considering PPP options, but they're unclear what phase they are in, and it's difficult to make that decision without clarity on when that option is available. So what phase, I think maybe you've answered this, about what phase are nail salons, hair salons, personal trainers, et cetera in? Again,
I think this is probably the question that most people are interested in is, where do I fit in this phase? When can I open? And, the governor and the state have talked a little bit about, high risk and highly vulnerable businesses versus others. And that's really a standard that they have to apply and that they have to give some direction to. So unfortunately, I don't have those answers right now. But I know, the state is fully aware that this is a very important, pressing question for folks. Folks want to know, are they ready to go on Saturday or are they ready to go in 2 weeks or 4 weeks? And the only thing I can tell the public right now is we're going to continue to push for those answers so we can relay that information to our community.
As far as childcare, what is the plan for supporting childcare in our region to ensure that kids are safe, they don't spread infection to their families, and the programs can actually do what they need to do and continue on?
Sorry, Amy, could you say that one more time?
Sure. The question is, what is the plan for supporting childcare in our region? So kids are safe, they don't spread infection to families, and the programs can actually do what they need to do and carry on.
Sure, thanks for that. Yeah, we've been working with the child care centers and other organizations since the beginning of our COVID-19 response. And we're really working with them and helping as they develop plans for reopening and how they might protect their staff and their children. And much of it is centers around similar things, cloth face coverings, easy for me to say tonight. Face coverings whenever social distancing can't be maintained, keeping the group numbers under 10, doing those screening questions for both employees and anyone that might come in the building, encouraging curbside drop off for children. I know for some of the young children, it might be hard for mom and dad to just drop them at the door and not see them all the way to the classroom, but the fewer people we can introduce into the environment, the better. And so we've had some great conversations. The childcare providers in our community are doing amazing work and trying to get plans in place to prep for continuing service for those that have remained open and then reestablishing for those that had closed down.
All right, thank you, Frank. So I think one of the other pieces here is we're providing the group, and if people look to the county as a leader in this process. And so Jay, I'm going to turn to you for some of these answers, and Frank, please feel free to chime in as well. One of the questions is, what will be the county's directives relative to COVID-19 testing and tracing of department staff? And what is the procedure within departments should someone test positive? Is there going to be coordination with the health department related to tracing and additional testing? So we'll kick it off with Jay, and then Frank, feel free to follow up.
I think one of the big keys is hopefully you will never need it, but it's good to have that plan in place on what would happen just in case one of your employees does test positive. Like I said, hopefully that's not the case, but it's good to think of how are you going to clean your surfaces after it? How are you going to notify staff? How are you going to notify visitors that came in? If you're not a high traffic type of business, it may be worth looking at a visitor log, keeping track of who came in and some contact information with them. So that can help assist Frank's contact tracers, who've been doing this for many months so far. And from my view, have been doing such a great job of it. That's kind of why Tompkins County is where we're at.
Thanks, Jay. Yeah, and I would just add that the steps that you take before you have a case will help limit the impact if you do, right? So all of these things we're asking you to do about social distancing, cleaning often, wearing cloth face coverings, all of that limits the contacts that will be created if you do have a case. So as we've talked about before, once the case is identified, our nurses begin their investigation by talking to that case, and then they look at what other potential exposures might have been. And the less contact with people, within 6 feet for extended period of times, the less contact with folks if you're not wearing a mask, all of those things will limit the potential exposures and will limit the impact on your business or organization.
Great. So on that as well, will any of our frontline county staff or others have daily or shift temperatures taken? And what is the procedure should someone come to work and they have an elevated temperature?
Sure. So I think in the ROOPs as they're being developed, we're talking about what procedures we're going to follow, and most of that is the screening and asking those questions. It is important to remember in all of this, while we're starting this reopening process, going all the way back to the beginning, sick people need to stay home. And that's really important. We haven't talked about that in a while because we've kind of been in this lockdown phase, but as we begin to reopen, that's going to become vitally important, that we can put all the precautions we want in place, but the thing that's going to have the biggest impact is if we're sick, if we have symptoms, we stay home, get tested, seek advice from your healthcare provider, isolate yourself from others. So all of the precautions will be for naught if we have sick folks in our workforce. So doing those screening questions will be really important. And if somebody answers yes, they really should be sent home to isolate until they're healthy. All
right. Has there been any discussion relative to COVID-19 antibody testing of county staff?
Yeah, the antibody questions, when we get a lot, and there is antibody testing available. There are a lot of different versions of it. Not all of them are as sensitive as others. And so until, we're in a position where we're confident that, what the majority of testing that someone would seek for antibodies is as sensitive as we would want it to be, we wouldn't be recommending everybody do it. I would also say we don't yet know what being positive for antibodies means. We do hope that there is some protective factor, that if you have been exposed and are developing antibodies, you might not be able to get it in the future, or the symptoms might not be as severe, but we don't know that yet. And so the value right now to a positive result really is just that you were exposed at one point. And it does help us know kind of the totality of how the disease has impacted us thus far, but we're not recommending it yet for our county employees or really the population as a whole.
So Frank, before we leave this section, I do have a question that came in about thermometers. Are scanning thermometers effective or not? And should they be part of a plan? Should temperatures be part of a reopening plan?
Sure. If you have access to a no-touch thermometer, that it's good and it's good to use, but it should be part of a broader plan and using those screening questions when you bring folks in, because it's also important to know that a temperature isn't the same for everyone. We use the 100.4 as kind of a delineation mark that if it's over that, then you definitely have a temperature, everyone. But it's really about, is your temperature higher than it normally is? So if you're normally a 97-degree person, a 99-degree temperature is a temperature and could be symbolic of something going on. So it's as much about asking the questions about onset of fever, how people are feeling, as it is recording an actual temperature in that moment.
So I'm going to jump to retail establishments, and I have a couple questions about that. So when retail establishments, we've established a timeline for a reopening of their stores. When we can do that, the question is, how should they prepare for social distancing within their store? If in the current time frame, if they have 1 or 2 employees on site, what's the best practice there while they're doing pickup? And then what does it shift to when customers are coming back in?
Sure, it's still those simple ideas of 6-foot separation and cloth face covering. So, as you have employees coming back into the workplace, you're going to want to try to design work processes that allow them to separate from each other. You're going to want to clean surfaces frequently that are touched by multiple people, and again, wearing those face coverings whenever you can't maintain 6-foot separation. And then when we get to the point where clients or customers are starting to come into the store, there's several things that we want folks to think about, and the first one is density. Right, we want to make sure that we're not bringing large numbers of people into the store at one point, so that they're able, while in the store, to maintain that separation. And that might look different depending on the type of operation you have. So each organization would have to evaluate it. And then, of course, the distance, right? We want to make sure we have the ability to have that 6-foot separation. We've already seen it happening in businesses that are essential and are opening with lines or X's on the floor that show people where to stand, or one-way aisles, those kind of things. So it'll really be up to the business to kind of figure out processes that allow for that. Of course, face coverings, we want our employees to wear them when they can't maintain the separation. We want clients and customers to be wearing them when they do come back into the stores. And then hygiene, as I talked about, hand washing often, washing surfaces, and really building that into the routine, and not just relying on people to remember, but really saying, okay, once an hour, we're going to set an alarm and we're all going to go wash our hands. Well, separately, not in the same time, but and so really build processes that allow you to do that, so it becomes part of your daily activity, not something you have to try to remember.
So on to a different topic. What does the governor mean by liability processes? And what does this mean for small businesses or local retail or restaurants? Jason?
I don't have a great answer for that, to be honest with you. I'm sorry. I'm not really 100% sure what they mean by liability processes, other than I think what I can take from that is, building off of what Frank has talked about, is trying to minimize the exposure to the best extent you can, making sure you have good business practices inside your business, whether it's for your workers or whether it's for clients or customers, to minimize the potential exposure and I think ultimate liability. So, I think that's a good, those fundamental pillars are good pillars to build on.
So on best practices and this whole reopening phase, there are several questions about what happens if it's not followed. So if a business opens too soon or doesn't follow the phases, thoughts or comments about enforcement or how that will play out, or how it is playing out currently and may play out in the future.
Sure. I could talk a little bit about it. I think, Frank, you could probably add more to it. There's a process right now through New York Pause where individuals, residents, businesses can provide input as to a business has been open when it shouldn't be, or there is not good social distancing being practiced, et cetera, et cetera. And then there's a process we go through in the county to review those. Generally, the first approach has been through education. We reach out, whether it's through our environmental health or whether it's through other staff, whether it's the sheriff's office, et cetera. We work with those individuals or those businesses to educate them, to remind them that these practices need to be put in place. The expectation now is that businesses would have reopening plans that we could review and review with them to understand if they're implementing those plans. And then for the most part, we've had relatively good compliance. People have been following that compliance. They understand it. I think it speaks to a bigger component, and that is everyone has some personal responsibility in this, whether it's a small business owner, whether it's a resident, whether it's a family member or a big business or one of our larger business partners. Everyone has a personal responsibility to take ownership over this, whether it's practicing those 4 pillars, whether it's good social distancing, face coverings, personal hygiene, ensuring that your employees and your patrons, customers, or clients are also practicing those. And I think everyone can take a sense of responsibility in that promotion and education. And if we all do that to an extent, enforcement really does not become an issue. I know there are some folks that find it burdensome or may not agree with it necessarily. But I think in order to get through this without a resurgence, get through this so that more folks aren't hurt by it, families aren't hurt by it, communities aren't hurt by it, taking on that personal responsibility, will maybe seem it's all for naught, but that's exactly what we want. We don't want people to get hurt. We don't want people to get sick from it. So while enforcement is there and we have mechanisms to do that, I think the personal responsibility piece is the most important component to take away from that.
Thanks, Jason.
Yeah, and I would just add and echo that personal responsibility piece. We've all sacrificed a lot to get to this point, to have very little incidence of COVID-19 in our community. And we just got to be patient. We're talking about reopening now, where the exciting part is happening. We're moving into this next phase, and we just have to be patient with each other and take that personal responsibility so we can continue to move towards being, fully reopened.
Okay. One question that just came in about childcare and childcare in this community, because there was a local executive order. Jason, can you talk a little bit about how that shifted, or Frank, either one of you?
Sure. Yes, we did not renew the local executive order, which only authorized childcare facilities to serve essential workers. We did not renew that. We have in contact with our child care providers, and they are an essential business. So they are reopening, I think, at the pace that they feel comfortable with, understanding the requirements and regulatory environment that they work within, which can be different state agencies, so that they can open up successfully. I know I have personally been, I know Frank and Amy, you have been on phone calls, I think Jay has as well, with child care providers, working in partnership with the Child Development Council on their next steps so that they can continue to support the community. That's essentially what happened with the local executive order. So it's not renewed, but Frank, maybe you can add a little bit more detail to it.
Yeah, it really is about understanding that childcare is a vital component of getting back to work. And so now that all of the facilities have the ability to be open, obviously they have to make decisions based off of safety for themselves and the children and families that they're serving. And I know that they're working hard to put plans in place and reopen in this new environment so that they can support families getting back to work.
All right. Frank, another question for you. When will campgrounds be open and included in the phases?
Yeah, this is a popular question, particularly with summer upon us, although looking out the window, you wouldn't know it. We're right now, campgrounds are only being permitted for seasonal sites, and that's because for those individuals that's their home during the season. So that process has already begun. As far as camping on short overnight type stays, we're going to be following the state's lead. The New York State parks currently are not allowing camping in their parks, and so we'll be modeling them when they shift towards allowing that. Then we will begin the permitting process for our campgrounds here locally as well.
Okay. I think we're going to go to some final comments from each of you on any final tips or things that you can share with the different groups. Again, acknowledging that we're learning more and more from really what feels like minute to minute at times, but it's a fast learning curve. So I'm going to go with Jay first, if you want to share some thoughts as we close the session.
Yes, thanks, Amy. Just like to say that our group is available out there for people to use and adapt to their own purposes. It's not an end-all answer to what we need to do to reopen in a safe manner, but it does provide some thought-provoking questions on what individual businesses need to consider as they go to reopen. And if anyone has any questions, they know where to contact me.
Thank you, Jay. Frank, final thoughts?
Sure. Yeah. And to follow up on that, Jay, if folks are, whether they're using our ROOP template or they've got something from a professional organization, we certainly encourage them to use whatever templates they can find that are useful. But there's really these 4 key components that we need to be thinking about. The first being density. Right? We don't want large numbers of people together. So however we can design our work processes to reduce density, both in staffing and in customers and clients as we move through phases is important. Social distancing is with us. So that 6 feet separation, we need to make it so it's possible for folks to achieve that. And when they can't, to be wearing face coverings, right? We want folks to have cloth face coverings with them, to wearing them when they can't maintain that 6 foot separation, and just get used to that being a part of our daily activities. And then the 4th one is personal hygiene, that hand washing, cleaning surfaces, just making sure we're doing those things that we need and making them part of our daily activities. So it's not about having to remember, it just becomes something we do. And then the last thing I just want to add, I said it a little bit earlier, as we start moving into reopening, it's really important to focus back on that message of if you're sick, stay home, right? That's the single worst thing that can happen is if you're not feeling well and you come out and potentially expose other folks. So whether it's through the screening process or just individuals, understanding their bodies and themselves and not feeling well, please stay home, seek testing if you want, seek out guidance from your healthcare provider if you need it, but please stay home if you're not feeling well.
So before I skip to Jason, one more question Dominic just threw in that I'm going to throw to Frank real quick. For businesses that are asking patrons to wear masks, if a patron comes in and doesn't have a mask, how strongly should the business encourage them to use a mask? Since there are limited supplies of, the one-time use, where is the line on that?
Yeah, it's a really good question. And I don't know that there's a real black or white answer here. We have found whenever we've had conversations with people about needing to change behavior during the COVID-19 response, once we've had those conversations, people have worked with us. And so I would encourage business owners and other organizations to have a conversation, right? Stay 6 feet away. You're wearing your cloth face covering, man, I can't wait till I can't have to say that anymore. You're wearing your face covering. Maybe if you can have some to give out to people, you know, I'm sure they would appreciate that. You know, you always have the right to refuse service, you know, to someone, but, you know, it's kind of like the no shoes, no shirt, no mask, you know, we're adding to that, but, you know, be gentle, be kind, be patient, have conversations about it. And hopefully we as a community will be able to work together and get folks to help us with, you know, wearing face coverings when it's necessary.
Thanks, Frank. And Jason, your final thoughts?
I think I'll build a little bit off of what Frank just said in terms of being patient. I think everyone is eager to want to reopen. There are definitely going to be some changes that are not going to go away once we reopen in terms of our lifestyle, in terms of things like the face covering, things like social distancing. And I think the sooner we can understand that, accept that, and appreciate what it means for everyone, I think the easier it'll be for us to move into the reopening. I can attest that, you know, no one is as eager as we are to ensure that we reopen safely, get our economy back starting, getting people back to work, which I think is what we all want to see. I would just ask that people be patient as we start to understand what type of direction the state gives down. I can make this commitment to everyone watching in our community. When we get that information, we will be sure to pass that information on to the community so they're aware of it. We want to work with the businesses and our organizations in our community and our community partners to ensure they have the right resources they need to be able to open and answer any questions that they have. So as we go through this learning process, unfortunately, not everyone is going to be in phase 1. Some people will be in phase 2, phase 3, phase 4, and that means from another perspective is they have more time to prepare, plan, and be ready to move on this the right time at the right way, the right time. So, you know, getting it right the first time, I think, is what's most important. The last thing we want to do is regress in this process. So if we have time to plan, that's great. When it comes time to reopen, we'll be prepared and we'll be able to do it effectively so that we can stay open and we're able to address any future issues that may arise. So, you know, we, I think, are turning the curve on this in terms of light at the end of the tunnel. I ask everyone to be patient, bring your questions forward, and we want to do everything we can to make sure everyone's prepared to reopen successfully the first time as we go through this process.
So thank you all for your time, and thank you to our partners who helped to coordinate this and get this out to their networks, the Chamber of Commerce, TCAD, the Workforce Development Board, Downtown Ithaca Alliance, and various others. I thank you for bringing your businesses and their concerns forward, and we'll continue to work with all of them as well as all of our other partners in the business community and higher education community and all the other communities within Tompkins County. I think we hit on this, that we really do want to be patient and move forward as we do the reopening, and we'll continue to push out information. As Frank mentioned, we are going to be adding to our website a reopening page, and so we'll be sharing that link later this evening, and we'll continue to push out information. So thank you everyone for tuning in, and thank you for everyone for participating. Have a good evening.
Thank you. Thanks, Amy.